Hello, I'm Dr. Duff Sprawls. I'm here to try to explain what is chemotherapy. The word chemotherapy means use of any drug, such as even including aspirin or penicillin, to treat any disease. But to most people, chemotherapy refers to drugs used for cancer treatment. It's often shortened to the term chemo. Two other medical terms used to describe cancer chemotherapy are anti-neoplastic, meaning anti-cancer, and cytotoxic, or cell-killing therapy. The history of chemotherapy starts back in World War I. The first drug used for cancer did not start out as a medicine. Mustard gas was used as chemical warfare during World War I and was studied further during World War II. During military operations in World War II, a group of people were accidentally exposed to mustard gas and were later found to have very low white blood cell counts. Doctors reasoned that something that damaged the rapidly growing white blood cells might have a similar effect on cancer. So in the 1940s, several patients with advanced lymphomas, cancers of certain white blood cells, were given the drugs derived from mustard gas. Their improvement, although temporary, was remarkable, and that experience led researchers to look for other substances that might have a similar effect against cancer. As a result, many other drugs have been developed. Why chemotherapy is different than other treatments, like radiation therapy and surgery, these are considered local treatments. They act only on one area of the body, such as the breast, lung, or prostate, where the beam is directed, whereas chemotherapy is given systemically. It goes into the blood and travels throughout the body. There are certain ways to use chemotherapy to treat only one part of the body, but that's not the usual. The usual chemotherapy is used to treat cancers, and there are more than 100 chemotherapy drugs in use today, either alone or in combination with other drugs or treatments. As research continues, more drugs are expected to become available. These drugs vary widely in their chemical composition, how they are taken, their usefulness in treating specific forms of cancer, and their side effects. New drugs are first developed through research in test tubes and in animals. When drugs are tested in clinical trials in humans to find out how safe they are and how well they work. Be sure and talk to your healthcare provider to make sure you know what medicines you're receiving. Be able to say their names, what they're for, and what is being treated. You need to know the name of your cancer and the name of your treatment in order to effectively communicate with any other healthcare provider. This is very important. Be sure you understand what you're about to receive.